Hi everyone, in this video I'm going to talk about methylprednisolone. Methylprednisolone is a potent glucocorticoid. It has minimal to no mineralocorticoid activity. It can be given to you to reduce inflammation in your body. Methylprednisolone can suppress the immunity, thereby it inhibits symptoms associated with an elevated immune response. It can reduce swelling, itching, redness, and allergic reactions. Therefore, it can be used for a variety of inflammatory conditions like arthritis, asthma, severe allergies, ulcerative colitis, adrenal problems, and many more. In this video, I'm going to discuss few important things about methylprednisolone, like how this medication works, how to take this medication, what the important precautions and side effects are. Please don't forget to subscribe to our channel and hit the like button if you really enjoy this video. Without any delay, let's start our discussion. How it works. Methylprednisolone affects the metabolism of carbohydrates, proteins, and lipids in your body. It also affects the fluid as well as the electrolyte balance. One of its main actions is to control the inflammation. Methylprednisolone controls the rate of protein synthesis, thereby preventing the release of inflammatory mediators in the body. It also suppresses the migration of leukocytes at the cellular level. This reduces progression of inflammation and relieves the symptoms like swelling and allergic reactions. How to take this medication? Methylprednisolone is available as a tablet in different strengths, ranging from 2 mg to 32 mg. It is also available as an oral suspension and powder for injection. Methylprednisolone can show its onset of action within 1 to 2 hours after oral administration. It is extensively metabolized in the liver. The dose of methylprednisolone highly depends on the purpose of use and the patient's conditions. Therefore, the dose is individualized. Typically, it can be started at an initial dose variable from 4 mg to 32 mg. This medication should always be maintained at the lowest dose possible. Therefore, after a few days of treatment, your doctor may gradually reduce the dose of methylprednisolone to a maintenance dose where it is effective. Similarly, when you're withdrawing this dose, you should not suddenly stop this medication because it can produce risk of the withdrawal effects. Therefore, you should gradually reduce the dose in order to minimize any adverse effects. Thyroid levels. If you have any thyroid problems, you should use methylprednisolone carefully. In case you have elevated thyroid levels, this medication is more cleared from the body, resulting in a loss of efficacy. On the other hand, if you have low levels of thyroid, clearance is reduced, resulting in the increased activity of methylprednisolone. Therefore, according to the thyroid levels in your body, the dose of this medication should be properly adjusted. Risk of infections. Methylprednisolone can reduce your immunity. Therefore, it can increase the risk of infections. It may reduce the resistance to new infections, or it can exacerbate existing infections in a few people. Few infections may be reactivated because of immunosuppression. Few of the infections can be in the sleeping form that is called latent infections. Such types of infections are suppressed by your immunity. However, when you're taking the methylprednisolone, your immunity is suppressed so that these infections are reactivated. This is commonly observed in the viral as well as fungal infections. Therefore, if you find any development of infection with the use of methylprednisolone, you should withdraw this medication. However, you should not suddenly withdraw this medication. You should gradually reduce its dose, particularly when you're using it in higher doses. Effect on prolonged use, methylprednisolone may increase your intraocular pressure. This may produce eye pain and blurred vision. If it is highly elevated, it may lead to one of the conditions called glaucoma. Even methylprednisolone can increase the risk of cataracts. So if you have any risk factors for developing cataracts or glaucoma, you should avoid this methylprednisolone. Effect on blood pressure. When you are using methylprednisolone at higher doses, it may cause elevation in your blood pressure. It may also increase the salt and water retention. Normally, this medication has no mineralocorticoid activity. Therefore, at regular doses, it is not affecting your salt and water retention. However, at higher doses, it may become non-selective so that it can also produce mineralocorticoid activity that results in increased salt and water retention. It can also increase the excretion of potassium. Therefore, this may elevate the blood pressure. Therefore, while you're taking methylprednisolone, you should restrict your salt intake, as well as you may also take potassium supplements to restore hypokalemia. Effect on bones. Methylprednisolone can increase the calcium excretion, which may weaken your bones. Therefore, it can increase the risk of osteoporosis if it is used for the long term. You should always use the lowest possible dose of methylprednisolone for treating inflammatory conditions. Long-term treatment with methylprednisolone can increase muscle pain as well as delay in the wound healing. Other effects. When it is given to the children, it can suppress the HPA axis. Therefore, it can reduce the growth in the children. In adults, it may result in the development of a condition called Cushing's syndrome. It is associated with weight gain, high blood pressure, rounded face, and hyperglycemia. Side effects. The side effects produced by methylprednisolone are variable and depend on the dose that is used. It can produce a few common side effects like headache, hallucinations, muscle pains, and insomnia. It can also produce fluid retention that may lead to peripheral edema. A delay in wound healing can also be observed. In a few people, it can produce acne and increase sweating. Elevated glucose levels and glucose intolerance may be observed. It can also suppress the growth in the children. At higher doses, it may cause gastric ulceration and pain in the eye. That's all, guys. These are the important facts that you should know before using methylprednisolone. Thanks for watching this video. Share your experience and side effects you have observed in the comment section below. Have a great day.